You're listening to The Disconnect, a podcast about anxiety and how it disconnects you from your normal self. We're here to share our journey and help you through yours to show you you're not alone. And now, your hosts, Austin Grant and Lindsey Jones. Welcome to episode 10 of The Disconnect. For those of you who have been following along with us, welcome back. If you're just tuning in for the first time, we're so glad that you're listening. In our most recent episode, we talked about anxiety over money and whether or not it does solve all your problems. Today, we wanted to talk about something that both of us have struggled with, which is white coat syndrome and hypochondria.
It's a rough topic because it's so anxiety-inducing.
So, those of you who don't know what white coat syndrome is, Lindsey will define it in Lindsey's terms.
Oh, in Lindsey's terms.
It's like layman's terms, but Lindsey's terms.
So for me, white coat syndrome is just the anxiety of going to the doctor. I kind of talked about it a little bit before, but it took me a really long time to be able to go to the doctor to actually see if I had a blood clotting disorder, which is what my mom passed away from, because I was so terrified of having that actually be like a thing for my life and what that would mean for the rest of my life. So just that anxiety around going to the doctor and having to make your own doctor's appointments. I feel like it's so easy when you're younger because your parents are like, oh, you're going to go to the doctor, and you just implicitly trust them. But then when I got to be an adult and I have to make my own doctor's appointments, it's like I am terrified of going to the doctor now. And I don't know why. Like, I trusted my parents so much to make those doctor's appointments for me. But now as an adult, like, I don't have that same trust for the doctor that I did when I was younger. So it took me a very long time to actually go to the doctor because of how anxious I feel. And I think the white coat syndrome is just that anxiety that you feel about going to the doctor.
Healthline.com mentions that white coat syndrome is when some people find that their blood pressure is normal at home, but rises slightly when they're at the doctor.
Okay, I was close.
It says the syndrome gets its name from doctors and medical staff who sometimes wear white coats in a professional setting. So it's funny that they said that because one of my primary doctor, him and I are on the same page, you know, he gets me. I'm like, yeah, my heart rate's high, my blood pressure's high, I promise I'm not dying, doc. And he said something funny to me one day. He was like, I mean, that's why you never see me, like, I don't wear a doctor's coat. I just wear normal clothes. Like, I think it's intimidating for doctors to just show up dressed to the dime and wearing a white coat, you know. And so it's like, I never thought of it that way because it's never like, oh, I see, you know. Like, I guess it makes sense, but I never thought of it to that extent. But it's just the setting, the being in there, sitting on that cold, weird, like, bench chair thing, bed, whatever it's called. It smells weird, feels weird, it's cold, and you're just waiting. And then you hear the little knock on the door, and then you're like, oh, God, it's coming. You're like, it's here. And then they ask how you're doing, you know, and you're like, fine, quick, yep, cool, great, let's get this over with. And then, yeah, it's that little cart, you know, they bring the little blood pressure thing over, you got your little pulse oximeter thing on your finger, get your heart rate going. They're like, is your blood pressure always this high? I was like, yep, I have chronic anxiety.
Yeah, as a healthy 20-year-old, I have really bad hypertension.
Yep. And I'm just like, do I have hypertension? What are the symptoms of hypertension? Google symptoms of hypertension. And then I just...
While sitting there with the doctor.
Yep. And it's not fun. And so, like, I just, like, consciously, like, bring those thoughts out of my head and ask it to the doctor, and then if they're like not getting me or understanding me in a way, I'm like, no, but like really though, am I dying or and so the last time I was at the doctor's, because this is something that happens all the time, you know, dentist's office, freaking doctors, well, you name it, like anything with
Medical staff.
yeah, any sort of yeah, nurses, EMTs. I see a paramedic driving away. I'm like, oh, what happens if I get in that? What happened? Yeah, no, it's just horrible. And so last time I was there, takes my blood pressure and everything right in the beginning. It was, super high. And I was like, well, great, wonderful, dying. And then talking through it, the checkup or whatever it was. And by the end of it, it was 30 minutes later, whatever, like I felt calmer. And so I was like, hey, can we take my blood pressure again? Completely normal.
Mm-hmm.
It was just in that beginning. It just psyched myself out so much.
Mm-hmm.
And not wanting my blood pressure to be high just made it worse.
Do you think in the future they might change the order in which they do like that entrance exam thing that they always do where you're talking about like, oh, they check your blood pressure and they do all that crap. Like they do all that at the very beginning. Do you think that they might change that in the future to where they do it at the end because of white coat syndrome?
I mean, it's just routine. Like they have to make sure, obviously the nature of your visit, but then they have to make sure, your vitals are good and there's nothing major wrong. But I guess I don't see any issue as to why they couldn't wait.
Yeah, because they like the doctor does try to like come in there and ask questions and ask you how your day is, and they try to like have a conversation with you, which I definitely appreciate, and I think it helps because like you were saying, like your doctor doesn't wear their white coat because it's intimidating, and I think a lot of people would have a different medical outcome or like a different like diagnosis if they did more of that, like checking your vitals at the end of your appointment or nearer to the end of your appointment after you'd kind of sat with your doctor and maybe talked about like what's going on, how are you feeling, all this stuff, why have you come in to visit me today, stuff like that, and then they check your vitals. Because I think like having that conversation and really getting your mind off of the fact that you're in the doctor's office and just kind of like settling your nerves can help people maybe lower their blood pressure while they're just having a normal conversation with the doctor. So I wonder if that's maybe a thing that they could do in the medical profession, is just like give it a minute before you take somebody's blood pressure, because like it's the same for me. When I first get there, they're like, oh, your blood pressure's a little high, and I'm like, yeah, it's because I'm freaking out over here, which like I think a lot of people have. So I wonder if that might be like the solution to that, and maybe just helping even those diagnoses be more accurate in just changing the order in which they do your vitals.
Here's something to make you feel better. It says, another study found that death from heart disease was strongly associated with white coat hypertension.
Perfect. We're all going to die because of doctors' jackets.
What if they change the color of their jacket?
Oh, can we have them all like wear rainbow jackets?
If you are a medical professional and you're listening to this message, take my blood pressure at the end of our meetings.
And wear a rainbow colored coat.
And wear rainbow colored coats.
Wouldn't that be fun? I think that would be so good. That would be so cool. I would 100% go see a medical professional who's wearing like a rainbow colored jacket. That'd be so dope.
So, have you had any surgeries in your life?
Outside of getting my wisdom teeth out, no.
Because that is also something that terrifies me.
I've been relatively lucky in that. Like, I've only ever broken one bone. I broke my wrist when I was in like 4th or 5th grade. The one and only time I went rollerblading. And then had my wisdom teeth out in high school. But I mean, they put me under when I was in high school to get my wisdom teeth out, which was weird. That was like probably one of the weirdest experiences, because I kind of woke up halfway through and like I don't think this is a normal thing that happens. I think they just miscalculated the amount of drugs that they gave me. So I don't think, for any of you listening, that this might freak out. I don't think that this is a normal thing. But I kind of woke up halfway through, and I remember the doctor being like, "Oh, she's awake." And I could feel him, like, if I think about it, I can still feel the sensation of them like tugging at one of my wisdom teeth. It didn't hurt, and it was just like a weird sensation. It was kind of like a dream. And then when I like came to, I had to like ask them, like, did I wake up halfway through, because it felt like a dream. But I did. And I can still remember that feeling if I think about it hard enough. But that's the only time that I've ever been like sedated like that.
It's okay. If her story just gave you massive anxiety, I had to get my wisdom teeth out a couple months ago, and when I went to her for advice, she told me that.
I told him the same story.
And I was like, well, more reasons to prolong this procedure that I've been putting off for 2.5 years. Every time I go to the dentist, they're like, it's easier to get your wisdom teeth out now than when you're in your late 20s. And I was like, easy for you to say. You're a doctor. And so I just kept putting it off. Like, I was like, I don't know if I need that right now. Especially with what happened this past summer. I was like, that does not sound good. But then September, my dentist appointment, talking to him, and then I was walking out, just ended up scheduling the consultation, and then just went for it. And so I knew I had like a couple months, because it takes forever to schedule those things. So I was like mentally preparing. Then they call me and they're like, "Oh, we have a opening in a consultation for Monday," and it was Friday, and I was like, "Sure, why not?" It was like 3 weeks early, so I was like, "Okay, it's just a consultation. They're just gonna stare at my teeth." Literally that day, the medical assistant or the hygienist or whatever, I don't even know what her title was, but she was like looking at me. She's like, "I can tell you're just so stressed." I was like a nervous wreck, couldn't sit still.
You're like,
I was
"Listen,
shaking.
lady,
I was
you
like,
have no idea how stressed I am."
I can't be here. And she was like trying to talk me through it. She said, "It's going to be okay." And I was like, "It's not. It's not going to be okay.
Don't lie to me."
And so then, we get through this consultation. And then we go to schedule the appointment. And so based off everything I heard, I was like not worried about it. I was like, oh, it takes like 2 months to get these things scheduled. So from now, it's just a consultation. There's doing no poking of the mouth or no knocking out, whatever. I have 2 months to mentally prepare for that.
Mm-hmm.
They're like, "Oh, we have an opening on Friday." And I'm like literally my heart drops. And I was like, I should probably do that to just get it over with and not even have to think about it ever again. So, courageous me just says, "Sure, let's do it Friday." So I ended up getting my wisdom teeth out 3 weeks prior to the original scheduled consultation. Terrifying.
Is that one of those times where you're like, "I better do this before I chicken out"?
Yes. Because I chickened out for so long, even scheduling the consultation, every time I went to the doctor or the dentist's office, I was like, the longer I ride this out, the longer I'm going to just put it off and find ways to cancel. And so that week, I remember asking you specifically, like, "Oh, what if I have a reaction to the anesthesia? What if, and you're like, "Well, I only woke up between mine," and I was just like panicking.
Okay,
thinking
so
I was going to wake up.
I just Googled it because I wanted to actually know like how rare it is. It says there's about 21 million patients who receive general anesthesia in a year in the United States. And of those people, only 26,000 experience anesthetic awareness, which is what I had. According to my calculator over here, that is a 0.001% chance. So it's really not a lot. It's not a lot of people.
Tell that to my anxiety.
I'm just a special little snowflake over here. It's fine.
So it did not help. So it's okay if you're stressed out.
Yeah, because the chances of it happening are like ridiculously low.
Well, so, my brain, I went in day of, and I was like, all right, let's get this over with. Like, Also, if you're getting your wisdom teeth out, do it in the morning. Because waiting till 2 o'clock in the afternoon, thinking about it all day, not being able to eat or drink anything is not good for your anxiety. Anyways, so I get there, and then, they're taking me back, about to put me under and everything. It took a lot. Like, they could tell I was fighting it. I was just trying to talk to them, and they're like, okay, just close your eyes and try to fall asleep. And you can tell that they were, like, trying to, like, get me to, get knocked out. And then I just remember falling asleep. And then I remember waking up and, like, looking at them, and I was like, oh, no, it's happening. I was like, I'm not supposed to be awake yet. But, like, I remember opening my eyes, and I could not move. I could not sit up. And then they're like, okay, you're done. And I was like, did I wake up? And they're like, no, you just woke up right now because we woke you up. And I was like, but did I wake up during the thing? And they're like, no. So I was fine.
Yeah,
felt like 2 seconds.
You're totally fine.
And then recovered, doing great. Here I am, I'm alive. Slapped my anxiety in the face. And it was great. Well, it was great after the fact. And now knowing that I no longer have that sitting in the back of my mind is something I should probably do. And yeah.
I'm trying to look up the how common it is to get struck by lightning to have a comparison. I think you have a better chance of being struck by lightning in your lifetime than you do of waking up from general anesthesia.
Tweet
so
that.
Like, it's okay. I'm just a weirdo. But yeah, that's the only time that I was ever under for that. And it was a weird experience, like being that, because they like ask you, at least, I don't know if they asked you, but they asked me, they were like, okay, count backwards from 100. And I got to maybe like 90 and I was out. It really didn't take very long.
No, they just told me to close my eyes, and I was like, well, hi. I can't fall asleep because you just poked me.
Mm-hmm. Didn't they do your, like,
yes,
IV in your hand?
My arm was about to lose circulation and get cut off, and I was like, sir, my hand hurts. And it was like all red from my elbow up. And he's like, oh, and he pulls the little tourniquet thing off of my arm and then immediately gets blood flow back. And I was like, are you sure you've done this before? And so,
don't you do this for a living?
Yeah, I didn't really help.
Attention?
And then, he was just drugging me up with some anesthesia, and you could tell it was taking a while, and then I was just finally out like a light. It was the weirdest feeling waking back up. But
it is weird.
Anyways, been there, done that. If there's something out there, just do it. Don't put it off. Don't be like, oh, I'm going to give myself some time to prepare. Never works.
Oh, yeah.
You're going to give yourself time to talk yourself out of it.
Yeah.
And cancel those appointments, because I've been there. And so, yeah, now we get to talk about a lovely topic.
Proud of you for getting your wisdom teeth out before we move on. Just proud of you in general, but proud of you for getting your wisdom teeth out. Anyway, moving on.
Hypochondria.
Oh, no. Everything is wrong with me all the time.
Dr. Google.
Oh, that is such a bad rabbit hole to fall down. Like, I remember I get really bad migraines, and I had a really, really bad one time, and I just remember like Googling it and being like, migraines as a symptom, and like all of these things came up, and all of a sudden I self-diagnosed myself with an aneurysm. So, don't fall down that rabbit hole, because it is deep and dark and hard to get out of, because you give yourself even more anxiety than you already have about what's wrong with you. So like we've said in the beginning of our episodes before, please seek medical advice. Please go talk to your medical professional. I know that it's terrifying. I know that it's scary. We've all been there. Like a majority of people have anxiety around going to the doctor, but ultimately, if there's something wrong with you, they will be able to help you. That's what they went through however many years of school for. What is it, like 12 years to become a doctor or something crazy like that? Like 12 years of school, you should be an expert in literally anything that you're studying. So definitely go talk to your medical professional, even though it might be scary. And like take a friend with you. Like if you feel that will make it better, absolutely take a friend with you. There's no harm in that.
So it's actually also referred to as illness anxiety disorder.
There you go.
Worrying excessively that you are or may become seriously ill. It's that whole ambulance thing. I see someone show up with an ambulance like, oh yeah, so-and-so passed out. And I'm like, what if I pass out? What if that happens to me?
They're here for you.
Yeah, I'm like,
Ambulances, we're here for you. Should be their new tagline.
Terrifying. Just instantly run through that cycle in my head. Well, what if that happens to me? Terrifying.
The what if game is like super dangerous.
There's a ton of symptoms.
Of fear of...
Yep.
Well, what are the symptoms? Hit me with them.
Having so much distress about possible illnesses that it's hard for you to function. Yes.
Been there.
Finding little or no reassurance from doctor visits or negative test results. You're like, I mean, honestly, I had that. I had some blood work done. They're like, oh, you're fine. And I was like,
am I though?
What if you did the wrong arm? What if you
what if you took somebody else's blood?
What if you did the wrong, like, did you do the right blood panel? Did you like test for the right things? Like, and you just like doubting.
Actually, I had a blood transfusion with my dog this morning. Can you test again?
It's like, hi, I went to Harvard Med and Dr. Google's on my side.
According to the internet.
It says I should have this. And so if you do go to the doctor, just talk it through them. And like normally for me, like talking it through with a medical professional to reassure me that I'm not dying helps a lot.
Oh, absolutely. Like when I got my blood tested to make sure that I didn't have a blood clotting disorder, I had to talk to my doctor and be like, are you sure? And she's like, well, of the most common ones, and she's like, it would be very, very, very rare for you to have some of these other clotting disorders. So I tested for the most common ones. If you want me to test for the other ones, we can do that, but it's like $1,000 to test for it or something crazy like that. And she was like, of the common ones, you don't have it. And so she walked me through everything, like all of the different, like most common ones that I could possibly have and like the other symptoms of them. And I didn't have any of those other symptoms. So it was good to talk it out with her because it really helped me put into perspective, like, if I did have it, she would tell me. Like, she's not going to lie to me for no reason.
There's an article on what health anxiety is and how to beat it.
How do you beat it?
I'm reading.
With a baseball bat? Can you call Ghostbusters? Can they help you?
It's like, sometimes misinterpretation is due to assumptions about an illness. For example, my cousin died of cancer. It's only a matter of time until I get it. Me. Viruses spread easily. People in Africa are dying of Ebola. Could easily spread into the U.S.
It's only a matter of time before I also die of Ebola.
And coronavirus.
Oh, yeah, and coronavirus.
Now that's just spreading around.
That's
I'm like,
topical.
I've been to an airplane in the last, year and a half. What if I've contracted that? And then it's just like, oh, symptoms don't show up. And I'm like, well, what if I secretly have it? And then that happens. And it's just like constant. I just have to like not think about it. And just not let those thoughts go down that deep, dark tunnel.
Mm-hmm. Well, I think a lot of, like, we talk about Ebola, you talk about coronavirus, whatever. I think a lot of the anxiety has to do with how it's portrayed by the media. So, like, there's such this inflammatory response from media outlets of, like, people are dying from this horrible thing, and it freaks people out. Like, people go to their news outlets to understand the news that's happening in the world, and they hear X amount of people have died in such and such a place from this disease that they've never heard of. And I think it causes this inflammatory response, and it just sends people's anxiety through the roof. And like that's a super dangerous thing because it blows everything out of proportion. So like I think with the coronavirus, like right now, I know like it can be passed really easily, but there's also a lot of things that governments are doing to contain it. So I think, and I'm not 100% sure on this, I could probably do some research, but I know that people who have it are being quarantined to like make sure that they're not spreading it to other people. And so I think like a lot of those things is like you just have to make sure that you're getting your information from proper sources, because I also know that like there's a lot of misinformation around those sources. I actually thought, like, when I first heard coronavirus, I legitimately thought it was an internet meme. I thought it was like somebody making a joke about how they got too drunk on corona over the weekend and they called in sick to work because they have quote unquote coronavirus. So like when I first heard it, I didn't even think that it was real because I saw that it was like a meme on the internet. So I legitimately thought that it was a joke until somebody's like, no, people are actually dying of this. And I was like, oh, great. I'm super rude for thinking that it was a joke. But you just have to make sure that you're getting your information from the correct sources. Like, do your research around stuff before you get anxious.
So this article says how you can beat health anxiety or health-related anxiety. It says cognitive behavioral therapy
Oh, we
is the
love some
most
cognitive behavioral
effective
therapy.
treatment for any form of anxiety, including health-related anxiety. So this model focuses on our cognition, the way we think, and our behaviors, the way we act. The main concept behind CBT is that our thoughts and feelings about a situation affect how we feel and how we behave, and so we tend to assign meaning to specific situations, like, your arms are tingling. Oh, that's a sign of paralysis. And so it's not the actual situation causing our anxiety, but like the meaning, accurate or not, it says. And so CBT helps you overcome these fears by correcting irrational thoughts and changing problematic behaviors. Acquiring a certain mindset can help you approach anxious situations differently and learn to tolerate discomfort and uncertainty. So I've actually tried to do that sometimes before, like be conscious of like, okay, I'm sitting in the lobby, this nurse is staring at me, and my heart's racing, and I just feel like blood pressure's through the roof. And then I'm just like thinking back, okay, like I'm in my 20s, relatively healthy, don't have a lot of risk factors for any of the things that are running through my mind. I'm okay. And so kind of just reassessing and thinking, taking those irrational thoughts of like, oh, I have heart disease, I'm dying. Kind of, and then bringing some sense and logic into it, like, oh, no, actually I'm not, I'm just nervous. And it's like your nervous system just playing games on you because your brain's like, feelings.
Well, that's actually a really good cognitive behavioral therapy technique. So one of the techniques is looking at your underlying assumption and finding logical conclusions. So like you're saying, like, oh my God, what if I do have hypertension? What if I, do have high blood pressure, but you're only in your early 20s? Like, the chances of you having that are pretty slim. Especially since you're just a healthy, normal 20-year-old. Like, if you had a problem, it would have been diagnosed by your doctor, obviously, right? And so adding logic to it can really help tamp down some of those fears of whatever you might be thinking of is wrong with you, and can help you just kind of de-escalate yourself. Because with, like, anxiety around that, you just kind of like build up and up and up, and it starts to snowball, and then adding some logic to it can just kind of suppress some of those, or like quell some of those anxious thoughts and add some logic to your life.
Well, I've tried to tell myself that. I'm like, oh, my blood pressure's high. And then they asked me about it, and I said anxiety, and then they kind of like, okay. And if there was something truly wrong, or they actually felt like I was, like I had something wrong, or if I had hypertension or anything, they would say something. But then I'm like, okay, so are they just not telling me because they don't want to make it worse, and they know it's going to make it worse, so they're just going to like subtly hint towards the idea that I may have this? Like, and then I start just doubting myself, and like, well, why didn't they say that, and then that was that time when I was just like, Doc, can we just run the tapes again? Get the blood pressure going? And then that was like, okay, I'm normal. I'm not dying. So.
Yeah, having like concrete evidence of it, I think, can also help, because that really like that's definitive logic, right? Is having concrete evidence. So I think what you're saying is actually really it's pretty ingenious to go into that doctor's appointment and say like, can we actually test my blood pressure a little bit later and just make sure that like I don't actually have hypertension. Because if you know that you're more prone to having higher blood pressure when they first test it, when you first get to the doctor, maybe like ask them to test it a little bit later, just so that you know, at least for your own benefit, that you're not actually dying.
They're just like, yeah, we're going to check your vitals. You're like, nah, not yet.
Hi, can we wait? Hi, I'm not ready.
I got a prescription to wait. Yeah, it's not fun.
My therapist told me I could wait.
My podcast host partner says that I need to wait. So, if this is you, just bring that up. If you're stressing out about it, you're thinking you're dying, the blood pressure cuff goes on, your heart rate goes up, just take a deep breath. 9 out of 10 times, you're probably okay. Mm-hmm. Just ask the doctor to do it once you've kind of chatted for a little bit and gotten settled down a little. Because the thing that I like, the biggest piece that I've learned in these types of situations with this whole white coat effect thing is majority of it is because the person that I'm about to go see has no idea what I'm going through. Mm-hmm. And so that fear of like you're in such a vulnerable state and you're just like, oh, like they're going to think I'm dying, and they don't understand that it's just anxiety, and that's why I'm stressed. And so being more open about that in recent experiences with the doctors, and like my dental hygienist, I had gotten a new dental hygienist, and I was like, oh crap, we got to go through this whole process again. Like,
you got to make sure that she's not a serial killer here to steal your teeth.
Not even that. Like, I just, like, I don't want to go through the, like, process of having to re-explain why my blood pressure and my heart rate is so high every time I go in, and so it's just things like that, and so being more open about it. And then, most of the time in my experiences lately, they've been, like, super chill about it. They're like, oh, that's totally fine. Like one of the medical assistants at the doctor's office I go to, she is the sweetest person ever. And, like, she totally talks me down, helps me calm down. It's just, like, her attitude. And, like, once I open up about it, makes the world. Like, it's completely, like, helps me calm down. Like, eases the, like, tension that's built up and everything. And so just being open and vocal about it. There's no shame in, like, being like, yeah, sorry. Like.
Yeah, just being honest about it.
And not, like, being afraid that they're going to be like, oh, you're weird, your heart rate's too high.
Well, I think that's another thing to take into consideration. Like, they're just people, right? Like, if you go to a doctor, he's just a person, she's just a person, they're just people. So it's not outside of the realm of possibility that they experience the same anxiety that you do around going to the doctor. Like, can you imagine being a doctor and knowing all of these things that could possibly go wrong with you? I think that's actually like a thing. Like, medical students self-diagnose themselves with like all kinds of things constantly because they're always learning about new things that could go wrong. Like, I cannot imagine being an actual doctor and knowing of all the different things that could go wrong with me and having to live with that knowledge. Like, that is horrifying. Like, more power to all the doctors out there, because that takes like some kind of courage to be able to face all of that every day. So it wouldn't be outside the realm of possibility that they have the exact same fears that we do. around going to the doctor. So I think like you're saying, like opening up to them and just being honest about like, hey, I'm really anxious about this doctor's visit, or I'm really not doing okay, can just, help them help you, I think.
Yeah, pathology and anatomy and physiology were rough in school. They're like, oh, this is what your lungs are not supposed to look like.
It's probably not good for you. It's funny you say that. It's funny you use lungs as an example, because the reason I've never smoked a cigarette in my entire life is because when I was little, my mom was she was like a coordinator for some kind of anti-smoking thing, and they had all of this anti-smoking propaganda in the office that she worked in. And I just remember being like 7 or 8 years old and seeing what smokers' lungs looked like, and that terrified me from when I was that little. So growing up around like smokers and growing up and seeing people smoking like freaks me out. To this day, I freak out about that. So like it's interesting that you say that, because like that is another anxiety inducing thing for me, is like being around people who smoke, because I'm so afraid that my lungs are going to look like that.
My lungs are precious. Get your nasty stuff away from me.
They are precious, okay? They provide me with well-deserved oxygen.
So, as promised, we'd love to end each episode with a quote. Today's quote we found to be quite relatable to today's episode. This quote is from Mary Hemingway. And she says, worry a little bit every day, and in a lifetime, you will lose a couple of years. If something is wrong, fix it if you can, but train yourself not to worry. Worry never fixes anything. So I like that part where it's like, if something is wrong, fix it if you can. If you truly have a heart condition, work with your doctor and fix it if you can. If not, don't diagnose yourself and panic and freak out when it's just like, no, maybe you had a little extra coffee that morning, and like I'd start to like use these excuses.
Mm-hmm.
Like, yeah, I drank a lot of coffee and I'm anxious. And I mean, at that time I was drinking quite a bit of coffee. So that's like part of my reason in terms of why I've just cut out caffeine.
Mm-hmm.
Because I really wanted to do like an experiment on myself to see if it helps. It does, but still happens, and so like in those moments, if it's something you can fix, work with your doctor to fix it. But if not, don't go down that rabbit hole of freaking out over something that's not even in the realm of possibility.
Mm-hmm. I feel the same way about this quote, because I think like we spend so much time thinking about the what could be, or like the what if scenarios, that you kind of lose track of the present moment. And so for me, like a lot of the things that I do with mindfulness is just making sure that I'm in the present moment and not focusing too much about the what ifs, because focusing on the what ifs just really steals time and thought and energy from what you're currently focusing on, or like what you currently should be focusing on. And like this quote says, like in a lifetime, you'll lose a couple of years. Like those are years that you'll never get back. Our most precious commodity, and I think I've said this before, is like our most precious commodity is time. And if I'm going to spend my time worrying about something that might not happen, is that worth my time? Is that worth spending this resource that I have a limited quantity of? No, absolutely not. So I personally, every time I go to the doctor, I think about that, of like, I can't worry about that right now. Like I have bigger things to think about. I have the podcast to think about. I have our business to think about. I have homework or work to think about. All of these things that are infinitely more important than my, like, what if I have cancer? What if I have this other thing that might not even be a thing that I have, until somebody definitively tells me like, yeah, you have hypertension, or yeah, you are crazy, then I'm not going to worry about it.
All right. So we hope you enjoyed today's episode. We would love to hear, tips and tricks or ways that you guys cope when you're walking in that doctor's office that doctor's knocking on that door, what you do to help yourself calm down. And if there are any other quotes that you guys would like us to share on the podcast, please go ahead and send them to us. We'd also love to hear your story, get to know you guys, and go ahead and DM us on Instagram or Twitter at Frank Disconnect. We're excited to continue to go through life with you guys and share our journey and share our experiences. Be sure to send any questions or episode suggestions or topics to askfrank@frankdisconnect.com. Go ahead and give us a follow on Spotify and iTunes. We're also on YouTube, so hit that subscribe button. We'd also love it if you would leave us a review. Lastly, please don't forget to check out our Patreon at patreon.com/frankdisconnect. Thank you all for listening. Tune in next time for another episode of The Disconnect.